Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Well, how's everyone doing? It's evening time here, and I felt it was better to do it now, so I can cut down on the noise from my kids. But today we're going to be talking about neuropathy in general, and that's going to be talking about what is neuropathy, symptoms and causes, diagnosis and treatments and prevention. Now, I know we've talked about this issue probably several times now. I kind of like doing updates on this because things do change. But this time around, I went ahead and did it because we have a lot of new listeners, and I just want to get them up to date on, what the effects are of neuropathy, and maybe they'll learn something also tonight, or they'll be able to find the material that I post on my Facebook page, and they'll be able to read it over themselves. The same document I'll be talking about. But I thought that was a good topic to start with tonight, so that's where we're going to be, and that's coming up right now. I just want to reach out to all of you too, and I know many of you have noticed the advertisements. Those are affiliates programs that I've applied to, and all I do is ask for your support. It's products that you can purchase that kind of relates to neuropathy. And, if there's something you want to buy on the site, that'd be great. That's how it supports me. No cost out of me. You're not paying me. You're paying the affiliates where I get just a little sum of it. But I'm just trying to find other ways for me to make money to be able to pay my bills, such as this page and the editing and all that stuff that goes along with it. But, yeah, again, please, if you can, please hit the links that are in each post. All right, let's get started here. Neuropathy or nerve damage can cause and can result from a wide range of conditions such as diabetes and even treatment like chemotherapy. In fact, neuropathy, which is sometimes referred to as peripheral neuropathy, is not a single health condition, but rather a term used to describe a range of health problems involving damage to the peripheral nerves, as well as the symptoms of those issues. While the conditions are irreversible, you can now take steps to maybe to help with and prevent neuropathy or manage it through diet, lifestyles, and treatment. So first, here's the signs and symptoms of neuropathy. Neuropathy symptoms ultimately depend on underlying causes and the individual, but they can include, according to the Mayo Clinic of National Institute of Neurological Disorders and Strokes, it could be a sign of temporary or permanent numbness, a tingling, prickling, or burning sensation, increased sensitivity to touch, pain, muscle weakness or wasting, paralysis, dysfunction in organs and glands, impairment to urination, and sexual function. To understand how neuropathy acts in your body, it's important to know that your nervous system is divided into two parts. One part is the central nervous system, which controls the brain and spinal cord, and the other one is the peripheral nervous system, which transmit messages between the nervous system and the rest of your body. In turn, the peripheral nervous system is divided into a voluntary or somatic nervous system controlling all of the functions we are aware of and can consciously control, such as moving your limbs and involuntary automatic nervous system regulating process we can consciously direct, such as a heartbeat, breathing, and digestion. Damage or disruption to both voluntary and involuntary peripheral nerves can be involved in neuropathy. Sensory and motor nerves can be affected, according to the Mayo Clinic. All right, here's some causes and risk factors. The nerve damage behind neuropathy can happen in a variety of ways. Here's the first one: poorly managed diabetes. The most common type of neuropathy is diabetic neuropathy, which affects people managing diabetes with poorly controlled blood sugar, and it accounts for 60% of the total people with neuropathy. And that's where my neuropathy falls under. The next one is idiopathic neuropathy. The second largest group of neuropathy sufferers are those for which no cause has been identified, 23%, and therefore their condition is known as idiopathic peripheral neuropathy. And that doesn't give you much of an idea of what they're talking about. Okay, the next one is cancer. Specifically, chemotherapy-induced peripheral neuropathy afflicts 10% of Americans with neuropathy. HIV and AIDS accounts for 2% of total neuropathy cases and are attributed to HIV, AIDS, which can be due to the effects of the human body having immune virus or the drugs used to treat. Additional health conditions, including the autoimmune diseases and health events such as physical trauma, are associated with neuropathy. So for those that have a low count in B12, which is about 10 to 15% of people, and over the age of 60, have been shown that this is an issue, that they have low counts of B12. Now, some sources of vitamin B12 include fish, meat, poultry, eggs, and milk, and other dairy products. Getting more B12 in your diet is important if your doctor determines you are deficient through a blood test. But taking B12 supplements and getting injections is also the option, which I was taking B12 injections for a while there. And just got too much of a hassle, so I just buy them over the counter now. But according to the National Institutes of Health and Office of Dietary Supplements, they recommend daily allowance of the nutrient for most people ages 14 and older is 24 micrograms, though women who are pregnant and lactating should get 26 mcgs and 28 mcgs. But again, before you take any supplements, you always should talk to your doctor first. They may be interfere with other medications you're taking at the time. Taking metformin, which people with type 2 diabetes commonly use to control their blood sugar, may increase your risk of B12 issues, not having enough. If you are taking the medication, be sure to inform your physician so he or she can look out for other areas that you may be low on, vitamins. So you want to make sure that you're on the right dose, and recommend get your dietary advice from your doctor to make sure he is giving you the right medication. And if you're taking supplements, what milligrams, you need to ask all those things to make sure it works and it's not going to interfere with any other medication, like I told you already. That's the most and very important thing that you could do for yourself and your health. Mostly you want to check to make sure you have enough copper in your system also. But here's excess. If you take too much of nutrient consumption, getting too much of a nutrient can also lead to neuropathy as well. For instance, too much B6 can be toxic to the nerves. The normal requirement is less than 2 milligrams a day. Yet, many B6 supplements are 100 milligrams or more. B6 is also an additive to all sorts of packaged food. So if you take B6 supplements, you really should have your blood levels checked to make sure there's not any excess. Next topic is exposure to toxins in food. Toxins contained in food we tend to think as of healthy, such as seafood, can also lead to neuropathy. In our center, this one doctor here says she sees people with higher levels of mercury, which can cause neuropathy. The EPA reports that fish can contain mercury and recommends that children and women who are 16 to 49 years old, pregnant, and breastfeeding limit their servings to 2 to 3 a week. Arsenic, another heavy metal, can also cause neuropathy if ingested in high amounts. Usually, this results from exposure via drink water that has been exposed to industrial waste. Arsenic can be found in brown and white rice in trace amounts, but not at levels high enough to cause nerve damage. The previous article provides greater detail on the nerve damage that both mercury and arsenic can cause. Brown rice can have high arsenic levels, and that can cause neuropathy too, which again, you can take this document here that I'll make sure is posted in my Facebook page, so that way you can either take it to the doctor or read it for yourselves and go from there. So for myself, I take B1 and B12. Those are the twos that I take. So many of you that have neuropathy probably already know how this is diagnosed. There are a number of ways in which neuropathy can be diagnosed. Generally, the process will start with the physician taking down a patient's history that include a description of your complaints, as well as physical examination to check the functions of the area in question. After these tests are ordered, then the doctor will tell you what type of test he wants to give you. So it can either be an electrodiagnostic test, a needle examination, blood tests, skin biopsies, and quantitative sensory testing. So a prognosis of neuropathy. The prognosis for neuropathy depends on the type you have and how much it has progressed. Nerve damage can be permanent. However, correcting the underlying condition that caused neuropathy can allow nerves to restructure or regenerate in some cases. For instance, getting your blood sugar under control can help halt the progression of nerve damage and improve the symptoms of diabetic neuropathy. So now I like what I talked about earlier. There are different neuropathies, and there's more neuropathy and how it's diagnosed also. So you can just read all that information off the transcript that I'm sending via my Facebook page, so you get a better idea of what they are. A duration of neuropathy can be long-lasting, even permanent. However, in cases of cancer patients undergoing chemotherapy, the nerve damage can be temporary. Just over 2/3 of those who have chemotherapy experience neuropathy 1 month after their treatment, according to the review of studies. By the time you get to 6 months out, the proportion has decreased to 30%. So there's a small section here about treatment and medications options for neuropathy. There are a wide range of treatments and medications for neuropathy, depending on the type of nerve damage and the severity of your symptoms. Common over-the-counter medications that people reach for to address mild to moderate neuropathic pain include Tylenol, which I took. It only lasted probably about 3 or 4 months, and the pain just getting worse. There's also inflammatory drugs like NSAIDs, which is like aspirin, ibuprofen, naproxen. And then there's topical treatments such as capsaicin and lidocaine creams. When it comes to capsaicin, for me, I don't know if I'm allergic to it, but every time I put it on my skin, it burns. And you can't get that burn away. It takes a while. You're rubbing it with water and trying to get it off your skin, but it burns a lot. So for me, I stay away from anything that has capsaicin in it. I never found it to work anyways because I was more in pain than anything else. So that's something you might want to be careful of. And prescription medications can be taken as well, which is like Celebrex, opiates, which I take, and Tramadol. Parents can get a measure of relief from such traditional and non-specific medications, but they are more likely to gain relief from certain categories of medications that have a specific effect on the pain waves. They act on pain from abnormal nerve firings or nerve signals. So I want to get here and talk a little bit of the alternative or complementary therapies that you could use, which I've been posting on my Facebook page very, very much, just to get you guys used to using cannabis or any type of that comes from marijuana. But let me talk to you about that real quick. Derived from the same cannabis sativa plant that produces marijuana and hemp, it has been used in the treatment of chronic non-cancer neuropathic pain, but more studies are still needed to be done. A small randomized controlled clinic trial that was published in December 2019, there was significant reduction in intense pain, sharp pain, cold and itchy sensations in the CBD group when compared to the placebo group. Now this is the new one that I'm taking, and I got this suggestion from one of my listeners out there, and I thank you very much because I didn't think this would work. Even my doctor thought the same. But alpha-lipoic acid, it did, I wouldn't say cut it in half, but it did brought down the gates a bit, and it did give me some better pain levels to where, I didn't have that much pain at all now. So I thought it was real good to be using this, and I haven't stopped since. But when you get that chance, I would check with your doctor. The antitoxic has been used to treat diabetic neuropathy. It is a naturally occurring fatty acid found in foods such as spinach, broccoli, yams, potatoes, Brussels sprouts, yeast, and organ meats such as the kidney or liver. No, thank you. In 2016, the review of random controlled trials concluded that 600 milligrams of oral or intravenous alpha-lipoic and acid improved symptoms in 5 of the trials studied. The next one is carnitine. The body makes all of the catamine that is needed in healthy children and adults. So it is not necessary to get more from supplements or nutritional sources such as meat, poultry, and dairy. However, supplementing in its fatty acid form, known as acetyl L-carnitine, can help treat neuropathy. Some studies have shown nerve regeneration and an improvement in nerve pain. Alright, let's go on here, diet and neuropathy. Proper nutrition is key for preventing or treating any health issues that may be at the root of neuropathy. I really think that there's a problem that you might need to check into if you go see your doctor about diet. What it says right here is there is no one-size-fits-all, but a good start includes limiting sweets and sugar-sweetened beverages, as well as large portions of food that are high in starches and carbohydrates. Opt for a balanced diet that is heavier on vegetables and fruits and includes portion-controlled high-fiber and whole grains, low-fat or non-fat dairy. Having celiac disease can put you at risk for developing nerve damage. So if you have been diagnosed with this disorder, stick to the gluten-free diet prescribed for you. As the Foundation of Peripheral Neuropathy describes, gluten is found in many types of breads, pasta, cereal, and processed foods that contain wheat, rye, barley, and sometimes oats. If you have alcoholism-related neuropathy, it goes without saying that the best advice is to abstain from drinking to help control your symptoms. Heavy drinking can result in some of the nutrients such as vitamin B12, as well as directed poisonings of nerves can happen. Again, that's one thing you want to check with your doctor. Because, even though I'm taking this from, Earth Day Health, you still need to do some investigating for yourself and check into it, even with your own doctor. So how now can we prevent of neuropathy? As the Foundation for Peripheral Neuropathy notes, you can adjust your eating habits to address underlying causes of neuropathy such as diabetes, celiac disease, and nutrient issues such as not having enough vitamin B, B4, B11, and B38. Also, exercise can help you to prevent or slow the progression of diabetic neuropathy. Furthermore, according to Medline Plus, it can help to strengthen muscles wasted by motor neuropathies. Complications, man, I kept going on and on. I didn't realize the time was already 21 minutes. So let me see if I can find one last thing. Related conditions and causes of neuropathy. Following diabetes, idiopathic neuropathy, chemotherapy, and AIDS, other types of neuropathy make up the remaining 5% of causes of it. So you've got physical trauma, infectious diseases, compression, repetitive stress, toxicity, hormonal disorders, alcoholism, autoimmune disorders, and metabolic disorders. So at the very bottom, these are resources that this place here that I'm reading from has the best info in regards to neuropathy. So there's about there's about 8 different places. So click on those spots and see what they have to offer you. Might be a lot new or more information that you need. So that's something you want to look into. Oh, it looks like we've come to a close today. I'm so grateful for all of you. Take a look at some of those things I posted, the places that I've suggested online on my Facebook pages about the shoes, insoles, and then also the CBDs that I've been suggesting. Try them out, see how they work. And I will talk to you next week. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode, plus others, are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.